All right. So welcome, everybody. Welcome to the State House. My name is Allison Despathy. I'm so happy to see you all here. It really means a lot. I know everybody is very busy in their lives, so thank you very much for taking the time to be here. I know that just even looking out and seeing so many familiar faces and so many amazing people, I know that all of us have been working hard for years. For some people, it's decades of working hard to stand up for children's health, as well as health choice for all Vermonters, and our right to be able to make informed, private, personal health care decisions without coercion. And I know this is core fundamental right for all of us that we really believe strongly in, and we're here to stand up for to make sure that this is the path in Vermont and everywhere ideally. As Vermonters, I know we do hold a lot of core values, and our culture here is very much focused on caring for each other, our families, our communities, our environment. These are really important values that we all hold dear. And just thinking about each of us as individuals, for 25 years I've taught at the Vermont State Colleges. I have a clinical nutrition practice, and I'm sure you guys have seen this in your lives as well. We are all incredibly unique. We know that life is sacred, and we want to make sure that we honor and respect people's decisions when it comes to health and health care. And we also want to make sure that our children, we know that this is a right, a really fundamental human right, that they can live in a world that has clean air and clean water and clean food, and we can have access to real information and make these decisions without coercion. So these are core values for all of us, and it means so much, so thank you guys for being here. And a few other pieces I just want to share. We're very fortunate to have some legislators here this session, and hopefully moving forward, hopefully they'll all decide to run again and get reelected, who have been incredibly supportive in the State House here to stand up for these rights that we all hold dear. So we're very grateful, and I just want to give them a round of applause here as well. And you'll see, if you haven't, that we do have some really amazing tripartisan bills that support children's health, the health of all of our environment that we live in and care about here, and support our ability to make these healthcare decisions without coercion, as we've said, which is really core for all of us. So we will be able to talk about some of those bills and the tripartisan support for these as well. But first, before we get to some of the legislators to share some of the bills we have here, first I want to welcome our dear and beloved friend who has been fighting and working on the front lines, both throughout the country as well as throughout the world for a long time, on body autonomy and children's health and our ability to really make these private healthcare decisions on our own. So I just want to give a warm Vermont welcome to Mary Holland, President of Children's Health.
Such a pleasure to be here. I have to tell you that I first came to Vermont as a teenager. I spent time at the Middlebury Summer Russian School, and I have magical memories of that. And then I came and spoke in the Health Committee, my first time back in 2011, about the issue of vaccines and children's health. And then I came last year and wasn't able to speak to the committee, but I'm super excited to do that today, and I'm so grateful for your incredibly warm welcome. And, you know, I didn't plan to spend my life working on this issue, but I'm the child of two physicians, and I read the literature that said 1 in a million kids gets injured by vaccines, and I thought, 1 in a million, okay, that's okay. Little did I realize it's hardly 1 in a million. It's probably more like, you know, several in 100. Orders of magnitude different. And so after my son was injured, I said, and I'm a lawyer by training, there's something wrong with this system. There is absolutely no accountability in this system. The government recommends it, the government mandates it, and you can't sue the manufacturer and you can't sue the doctor. Like, where is the account? And the media is all bought in. Like, where's the accountability? What's gonna turn this around? And it was pretty obvious that it was gonna take a lot of effort to turn it around. Well, guess what? It is now turning around. And I've been in this for 20 years. This system is turning around, and I'm proud proud to say that the current Secretary of Health and Human Services, Robert F. Kennedy Jr., is the secretary at HHS, right, for the government. And he founded Children's Health Defense. And so he understands that the reality is that the childhood vaccine program has never been properly tested. There's not a single vaccine on the childhood vaccine schedule that's ever been tested against a true inert placebo. And the entire schedule has never been tested for safety. And that's been acknowledged by the Institute of Medicine, the highest medical authority in the United States, from 2002, and then again in 2013. And the CDC, pre-Kennedy, did nothing. And the American Academy of Pediatrics, with 67,000 members, did nothing. Not proven safety, obvious injury, right? In 1986, Congress passed the National Childhood Vaccine Injury Act, acknowledging if you do something for everybody and you mandate it, some people will be harmed because we are each individual. You can't mandate things and expect there will be no harm. So they recognize there will be harm and they set up a compensation program. So I am disturbed. I'm very excited by these 5 good bills here in Vermont. Kudos to the representatives who are doing these bills. Face masks, reporting adverse reactions, prohibiting discrimination based on immunization, and a health choice bill. As Allison said, vaccination touches on so many fundamental rights. It touches on bodily autonomy. There's nothing more sacred. If you can't control your own body, you can't control anything. All of our laws are basically built around the idea that you have rights in your own body, and then they extend to other things like your own property or your own family. But if you have no rights over your body, think about it. You have no rights over anything, but it's bodily autonomy. It's parental rights. Parental rights are fundamental. It is the parent who is charged with ensuring the best interest of the child, nobody else. And it's free exercise of religion. This is a religious issue for many of us. And if you can't make your own decision about your own body in alignment with your own conscience, that obviously violates the First Amendment. And then, we've basically been censored for so long. That's violating freedom of speech. Freedom of assembly has been challenged on this. So if we don't win this issue and have full, unfettered health freedom, it's going to signal to us encroachment on every other right that at the moment we take for granted in the United States and the world. So this is so important. I also will talk more this afternoon about this House Bill 545 that I understand has passed the House, which is basically trying to recreate here in Vermont at the state level a liability protection scheme for doctors and allowing the state to set its own vaccine schedule, fearing, obviously, that Kennedy at the federal level is changing the schedule, which he's done, and I can tell you more about that if you want. But at any rate, they're trying to create their own system. It is obvious that there are going to be major problems with this system that they're setting up that they have not thoroughly thought through. So they're saying that there are standing orders in hospitals. That means basically you will get a shot whether you want one or not, whether or not your own doctor recommends it. And it's suggesting that, that health insurers will have to pay a surcharge, and that it implies, because you're not going to be able to sue the doctor except for gross negligence or recklessness or intentional misconduct. If you die or your child dies from the vaccine or you're paralyzed, you can't sue the doctor. But they haven't told us, okay, but is there some kind of compensation mechanism, and how are you going to set that up? And I can tell you at the federal level, I've studied that injury compensation program very deeply over many years. It's really a difficult and bad system. You're not going to set that up overnight, and you're certainly not going to set up a successful program. And so what you're looking at right here with the government setting up a new system that it's on, the cusp potentially of approving, you're going to have children who are injured, and you're not at the state level going to know what to do with that. And that is tragic. And the science that is coming out, including through the work that we're doing directly at Children's Health Defense, but lots of other places. You may know that the Informed Consent Action Network just sponsored the Zervo study, and it's gotten attention through the film, An Untold Story. the science is showing us that children who are unvaccinated, who have the natural development of their God-given immune systems, are head and shoulders healthier than children who are vaccinated. This is just what the science is telling us, which helps us understand why the true science has been so radically suppressed by the industry and by the government that's recommending these, and by the American Academy of Pediatrics. And by the way, we just sued the American of Pediatrics for racketeering. We're very excited about that. And I can say that we are at an incredible point in this long-running issue, because the American Academy of Pediatrics is right now suing Bobby Kennedy and Health and Human Services, and there's a hearing next week in Boston on that, and they're saying you can't make these changes. You can't take the day of birth hepatitis B shot off the schedule. You can't say that this is for shared clinical decision-making, i.e. that the person and their doctor make the decision together and not some, faraway federal authority. They're challenging that. We're challenging them for racketeering. The schedule has already changed dramatically, more so than over the last 40 years. So we have a lot of momentum right now. This is a critical year. It is a critical year. Right now, it's full steam ahead. We don't really know what's going to happen after the midterm elections in November, how that's going to change the whole panorama, particularly for health freedom and the Make America Healthy Again movement. So I'm thrilled that you're here. Thank you all for coming. I look forward to speaking with you later today again. And again, thank you for your support.
Thank you so much, Mary. Obviously, we're so happy to have Mary here, and that was wonderful and perfect. And I just want to remind people, we do have, Mary's going to be testifying at 1 o'clock in House Healthcare Committee. 2 to 3:30 in room 11, we have a panel. But I also at this time wanted to ask a few representatives who hope to share a few words, if we can invite them up and give them a warm welcome. And Representative Burt, do you mind coming up?
Yeah.
Okay, great.
How are we doing? Great. I'm a farmer, so not a public speaker, but I try to do my best. But I wrote a speech that I want to give right now. Vermonters are nearing a breaking point. We all are experiencing the impact of rising costs. The burden that our state is placing on every Vermonter by extracting historic levels of taxes not only is entirely unsustainable, but it diminishes the power that each person has. Adding to the load again, several broad and sweeping standards have flown out of this supposed people's house and landed upon our citizens, threatening such regulatory weight as to crush us. And then there are the minorities amongst us, folks who under the crushing load are losing the ground beneath them. Vermont has historically taken links to ensure the rights of minorities, but it is surprising where there are still gaps. Gaps that go mostly unrecognized. Gaps that are misunderstood. Gaps that are scoffed at. Gaps that are belittled. Gaps that are even hated. Gaps that have sacrificed everything. Gaps that are debunked. Gaps left to the realm of conspiracy theory. Gaps that should no longer be able to participate in society. Gaps with loved ones lost. I stand here among worthy company. We are the gap. We believe in the sacred right of each person to decide what will be done to their body. Health choice, body autonomy. Some Vermonters may not understand health choice, but they do understand oppression, because each of us is feeling it in one form or another. And given the degree, sorry, like I said, I'm a farmer. And given the degree of disconnect that our political institutions keep from the reality of life for working class Vermonters, it's no small wonder that our cause is thwarted. The way out of this is to speak truth each day and to do so with respect, because we are not the only ones whose rights and powers are being suppressed. But the cause that we take is rooted in something deeper. The instabilities of society we see are stabilized by the rock-solid foundation of inalienable rights. And when we see the foundation being attacked, we take action. Health choice is at the front lines of that battlefield. The latest skirmish is H545 for us in Vermont. The bill quickly dropped in the Human Services Committee this year. 545 is one of the initiatives to quietly chip at the stone. I'll spare you from my speech, and I'll shoot from the hip now. So I'm grateful to, as a legislator, be helping with H393, which is the bill that would not allow schools to mandate face masks in schools anymore. And I want to thank. And I want to thank Allison for helping me out with Bill H274, which would make an amendment to our Patient Bill of Rights to make sure that your immunization status won't affect how you're treated at the hospital. And I put forth an amendment, and with help from Rob North too, on H545, and I tried really hard in committee to persuade folks of the importance of that amendment. Thank you. So that bill, my amendment to that bill, really addressed the liability and the immunity given to doctors, and I wanted to make sure that patients know that, right? There's a whole new field as far as I'm concerned in terms of the state taking over the authority to recommend immunizations and whatnot and have anything to do with this vaccine scheduling. So I think it's important that our patients at least have the information about that. It also asked for a written signature that they were given proper information when they did speak with the person who administered the immunization. It really wasn't a huge ask, I gave a floor speech on it, but I basically talked about how, we're constantly battling this balance of powers and rights and immunities within our society. And, I see the scales tipping in favor of giving more power to our institutions. And all the amendment is asking is that you give information back to the patient so that they are empowered to be able to make a decision for themselves. And not surprisingly, it was met with a resistance and an argument against it in committee, and I wasn't able to get a vote to turn toward it. So, but we're working on it. It's in the Senate now, and we're going to do all we can to make some changes to that bill.
Thank you.
Thank you so much, Representative Bird. Thank you so much. If I can have you hang on for 1 second, if you don't mind. I was just going to say, I just wanted to, hopefully this gives you all hope, because I know that we're all in our own worlds working really hard with our loved ones in our communities to share truth and to share information and to hope make people aware of what's going on so that they can make these informed decisions. And I know everyone is working hard on that, and I thank you so much. And I also want you guys to know that we also do have some representatives in here who are also very committed to that and working hard in here as we create laws and we try to protect people's fundamental human rights. So I just want to again give a round of applause to our representatives, who we're so grateful for their bravery to speak up and do this. And then I also wanted to, let's see, where did Rep. Taglavia go?
I'm right here.
Oh, sorry, missed him. Hiding behind the sign. So let's have Rep. Taglavia come on up and give him a round of applause. Thanks.
Thank you. It's an honor to be here. Before I get into my little speech, just some of the things that came to mind when some of the other speakers saying their words. We live in a state that was built on rugged individualism. We live in a state where people have had to be conservative and frugal for the entire history of the state to be able to survive. We live in a state of where my neighbors I know, most of them will resist to the very last minute asking for help because they're so fiercely independent. And things like 545, which I would have voted for if the Burt Amendment passed. I voted no because it lacked the informed consent that Greg Burt's amendment would have given it. We just need to keep that in mind where we live. The state of Vermont is unique among the 50 states. And if we don't do what we do inside of this building to maintain that uniqueness, then we lose our identity here in the state. So the other thing is, I'm reminded more than 250 years ago or something, I forgot who exactly in our history, said something about sacrificing our liberty for safety and having none of them. Just keep that in mind. I just want to thank you all so much for coming to the State House today to support Children's Health Day in Vermont. As adults and also as a legislator in service in Vermont, we have a responsibility to ensure that our most vulnerable populations, such as children, are supported in all possible ways and also protected from experimentation and controversial mandates. Mask mandates in schools during COVID were not based on science and did not offer protection for children. Our children struggled with masks on many levels, including experiencing increased bacterial infections, skin rashes, and headaches. Speech delays and impediments due to forced masks use surfaced, and our children are still recovering from this compromise. And we actually heard testimony in, I believe it was GovOps, where that particular instance is still a serious problem that's in need of repair. And the kids are still trying to catch up from that, years later. It was well known that masks did not prevent transmission, and despite the lack of safety data, mask use continued in Vermont, causing academic, communication, and health declines in our children. Moving forward, we must all work to ensure that our children are not placed at risk or experimented on. We must respect parents' rights to make decisions for their children except in cases of negligence or abuse. With regards to health choice, an individual's right to make private healthcare decisions is a fundamental human right, and I will work to uphold this right while I'm here in office. I will also continue to prevent government overreach in health policy and all areas of legislation. Choices in life are essential for liberty and health. I will work hard to uphold these rights for all Vermonters. I have signed on to many of the bills here in Vermont that strive to guarantee health choice. I appreciate the opportunity to speak, and I'm honored to be here to help secure health choice and prevent mandates for all Vermonters. Thank you.
Thank you, Rep. Tigermia, so much. The other thing I just want to say, I think we're all well aware that we live in this really agitated, polarized world right now. And despite that fact, I think that one of the asks that we have for our lawmakers is if they can rise up above that, and if they could stop politicizing science, and if we can bring honesty and transparency and the real information and the real story to the table so these conversations can happen. As we know, that's the way that we're going to be able to forge a solid path in Vermont here for everybody. So that's a big ask that we have. The other thing I just want to mention is we do have, obviously, all of these bills here for informed consent and body autonomy, preventing discrimination based on immunization, prohibition of requiring face masks for in-person attendance at schools. The other things that I want to mention, though, is we do have bipartisan and tripartisan bills that are also looking at getting rid of ultra-processed food, getting rid of food coloring. We have the ban geoengineering bill, where we do not want to be experimented upon with aluminum and sulfur in our skies. And And that is a real thing, and we need to be talking about it, because if we can't talk about it, then we can't get ahead of it. And right now, a lot of it is going to be, let's get ahead of it so we can put things in place and we can protect our air, our water, our food for our children and for all of us, which is what we care about here. So did anybody else want to speak at this time? Okay. And I think, did you have a question?
Yes, I did.
Yes.
WMRW Radio and MRV TV. So this bill, 545, the liability, now, it would also make the state not liable for its decisions and actions as long, you know.
I'm going to refer this to Mary, who I think as a lawyer could speak much better than I.
So, governments typically have sovereign immunity, and if they have some kind of alleged rational basis, it's very difficult, if not impossible. So they would definitely have, they would stand by their sovereign immunity. I think the big question here, they're saying that the physicians and healthcare workers would not have liability, but they haven't outlined what kind of compensation program there is in 545. And it doesn't say anything, as far as I could tell, about the vaccine manufacturers. So under federal law, the vaccine manufacturers are exempt from liability. So there's a lot of lack of clarity here. It's going to be a mess, frankly, if this goes through and is implemented anytime soon. It will be a mess. There's a lot of other questions there, like how is Vermont, who are they going to buy the vaccines from? Are they going to buy directly from pharma? Are they going to buy in one lot from pharma? There's just so many unanswered questions here. Without a clear health choice bill, I think that it could be very problematic. So I think in a certain way, the fact that they're seriously looking at 545 should strengthen the arguments for health choice, because they really don't have a well thought through system here. That's really clear. Right.
Thank you. And that was one of the things that we did. Some of us who testified in House Human Services were trying to also get H69, which is a bill that would require the Department of Health to put together and look at the vaccine adverse events and compile a report to share with the legislature. So we could be looking at lot numbers and vaccine damage and injury. It would be the only, it would be a responsible move with what they're trying to do with H545. And so H545 is now in Senate Health and Welfare. I am going to talk to Chair Lyons and see if she might give Mary Holland 5 minutes to come in to share some legal analysis and thoughts on this. So obviously, just as Mary started to point out and what we've been trying to do, there's a lot of issues with that bill that we're really concerned about. And we'll see what happens in the Senate. We're hoping for more opportunity to educate and point out some of the deficiencies there. Yeah. And any other questions that people had, Paul?
Yes, for Rep. Byrd, in the context of these bills, you've mentioned some opposition, and I have to imagine that some of the stuff that they're saying is interesting, to say the least. What are they saying in terms of opposition to some of these, for example, the face mask bill?
Well, can I speak to 545?
Absolutely, yeah.
Directly about that? I mean, after I gave my testimony to the committee regarding the amendment, someone from the health department came in and gave their take on my amendment, and they used the point that it's only 1 in a million are harmed by vaccines, and it's funny because they also talked about misinformation at the same time. But so that was one point that was made, and that my amendment was essentially unnecessary, which was also surprising. So hopefully going forward, I'm going to ask the chair at the beginning. I would request that I be able to speak after anyone who speaks after me, so I can give a rebuttal. The 1 in a million. But I would have loved to come back with, well, if it's only 1 in a million, why do you need to give immunity to the doctors? It sounds like this whole bill is unnecessary if you're going to talk about things being unnecessary. So, in terms of, we really got to get H393 off the wall to be able to have a conversation, the same with 274. And when I got into this, I realized that our patient bill of rights needs a complete overhaul altogether, with a statement about immunization status. So.
Thank you. Thank you.
Yeah.
It looks like there's another hand up. Yep.
I just just wanted to say, when you talk about compensation, it sounds like you're making it right. You can't make it right.
No, you cannot.
You've destroyed the parents, you've destroyed the whole family network, you've destroyed the community. There's no making it right.
Right.
So
Exactly.
just be sure to emphasize compensation is not enough.
Yes, exactly. And thank you so much. And really, we should, yes. And really, we should expand upon that, and we should say, obviously, the compensation program is hideous, it's horrible, it's criminal, and it's really, when you think of ultimately the role that it's playing, it's the cost of doing business for pharma. And I will also, that brings me to talk about Nicole Matten is a woman who lives in Barton, Vermont. She lost her daughter at 7 years old. Her daughter's name was Kaylin Matten. She got a flu zone vaccine that had mercury in it, and she died of myocarditis from the flu vaccine. It took her 11 years, and she received $250,000 from the compensation program for the loss of her child. That is so wrong, and thank you for bringing that up. And that's the last thing that we want to see Vermont do, is try to create some measly compensation program when really what we need to be focused on is honesty and transparency and informed consent, and ensuring that people have the right to make these decisions for themselves and their children. Yes.
Mary, the last time we spoke, you mentioned the states that were suing for fraud. I'm wondering if you have an update on the success of any of those lawsuits against the pharmaceutical industry.
So I'm not sure. So 19 states are, well, I'm sorry. So 19 states are saying that they're going to leave the federal vaccine program. The American Academy of Pediatrics and all of the major medical associations, the American Public Health Association, the Infectious Disease Society of America, all of them are suing Health and Human Services. They're not alleging fraud. They're alleging that Kennedy has violated the Administrative Procedures Act. They've got 4 claims under the Administrative Procedures Act. That hearing is this Friday, actually, the 13th, next Friday, a week from Friday, in Boston. We, Children's Health Defense, 2 pediatricians who were excommunicated from AAP, and 2 mothers who have children who died by following the AAP vaccine schedule. We are all plaintiffs against the American Academy of Pediatrics for racketeering, which involves their fraud. So they've been lying for decades that the vaccine schedule has been proven safe and that it's been robustly tested. That is absolutely a lie on behalf of pharma. And as Allison has said, what we really need, with real transparency and real science, vaccines are done, right? And that's why they need all of this camouflage. That's why they need the liability protection. And it is a remarkable system that they have built with, trusted pediatricians talking to young parents about, oh, your kid's going to die of polio if your kid doesn't get this shot. All of that's pretty preposterous in today's world. And the science is really showing increasing numbers of studies, but more needs to be done. Increasing studies are showing that children are much healthier when they're not getting these early batteries of tests. We are not an anti-vaccine organization, but we're pro-science and we're pro-proof and we're pro-choice. And as we're all saying, it has to be up to the individual with their chosen healthcare practitioner whether they want to do this at all, and if they want to do it when, and what they want to do and what the ingredients are. It has to be a matter of choice. It can't be mandated or coerced as it is now. It violates the most basic ideas of medicine. The Hippocratic Oath, first do no harm. Right.
Okay, oh yeah, Rich?
It'll be nice to get all these groups and individuals under oath.
Yes.
Really answer some questions.
Yes. At this point, I just want to just remind everybody we're going to be doing time in the cafeteria. 1 o'clock, Mary has her testimony. Room 11, 2 to 3:30. We'll continue this conversation and get into more details and a lot of the wins and the things that are happening on a federal level as well, and information coming forward. I have to say, as a nutritionist, I'm really happy to see the Flip the Pyramid. I've been teaching that for 25 years. And then I saw it happen, and I was like, oh, finally. So thank you all so much for being here. Keep doing all the work you're doing, and please also make sure that you're reaching out to your legislators and forming that bond and that communication so they can understand where you're coming from, and you can work to try to educate them as well. And we hope that our lawmakers will open their hearts and their minds to this information so we can all move together on it. So thank you all for being here. Thank you. Oh, and Amy has one thing, sorry.
Hi, folks. My name is Amy Hornblass. I'm director of Vermont State House. And this is so healing, having all of you here and having our representatives here who are supporting these bills. And I just want to let folks know we have some next steps coming up. The very next thing that we're going to be planning is a town hall hearing of the cost-benefit analysis of the COVID protocols. We're going to have a microphone right here in the State House in an evening when people can come after work and share their stories of what it was like to send their kids to school with masks, to have them tested every week, to not be able to see their grandparents in the nursing home or their wife when she was giving birth, and all the things that happened during COVID. We're going to give folks a chance to come to the mic the way we used to in Vermont, a town hall style, town meeting style, hearing from the people. So thank you guys. Thank you.